Hello, dear colleagues. How are you? My name is Berdikhojayev. Hello. My assistant is Rowan Itili. And now we have case number 2, patient number 2. Erkek kişi да, әйел ма? The young lady. Қанша жаста? Жасыңыз қаншада? Young lady, just 63 years old. Қорқпай жата беріңіз. Так, мынау коннектор бар ғой, да? Мынаны снимать ете сал. Қазір тұра тұр. Так, мынаны алып тұр. Қазір, пока керек жоқ. Так, метесін. Мынаны коннекторын алсам. Yes, patient is quite young, 63 years old, with a nearly 8 millimeter paraclinoid aneurysm. It's approximately 9 millimeter. 7.7 by 8.7, and there is a slight stenosis. It looks like the problem is the difference of the diameters. Ekranda just Stevens. Yeah. Yes, the distal diameter approximately 4.9. But it might be not so correct. Right vertebral territory is normal. Right carotid territory, slight tortuosity and the paraclinoid aneurysm. The other part is normal. This is measurement. And patient has ACOM. And yes. The strategy in this case is flow diverter treatment. Yes, there is a stenosis at the orifice of left vertebral artery. It's not so much, that's why we'll follow this segment. It's less than 50%. Okay, and now Rowan is going to the left side. Okay, let's check. Yeah, yes, the vertebral artery looks normal, or it's stenotic. Let's check. Because on the ultrasound it was look like stenotic, but right side looks normal, left side I couldn't see. Maybe later we will check, okay? Yes, the anesthesiology nurse is Nazım ғой, да? Okay. It's leaking. No, каптет той, да? Нормально. My connector is not correct. Okay, it's okay. It's okay, it was something like stenosis on the right side, on the left side. The right carotid looks normal. Okay, it's leaking. It's a vertebral territory. It's a climber, and the visibility of the climber is not so good comparing with the Hyperion. It's a left carotid territory. Okay, let's check. As a patient under local anesthesia, we have 3 nurses today. One is new one. The second is the first is chief nurse Bahat, and the second nurse is helping. And Evgeny Grishayev is today supporting with the live streaming. Okay, let's check. The lab day is a little bit not regular. It's look like no stenosis. Okay, let's check 45 degree. Okay. Let's look okay. Okay, let's go to the right side. The treatment plan is to place a neuroslider catheter, and then through the neuroslider and the Xeon blue wire, which is coronary wire 14, place the Vista stent. Vista 4.5, and the stent 4.5 may enlarge till 475, I hope. Okay, we can stay here. Okay, this is a presidential national hospital, Almaty city, Kazakhstan country, and yes, we have problem with the headway catheters. There is a end of registration. That's why we should work. We should work with the other kind of tools like a neuroslider, gamma. It's very comfortable condition. Yes, the device had a registration, and then registration finished, and device became illegal. It was legal, now it's illegal to use. It's very strange situation. I hope at one moment all these crazy things will stop. Okay. It's same with the physician. If you have now certificate, you can operate, and tomorrow certificate will expire, and then you are illegal. Okay, it's crazy. It's crazy. Yes, it's a regulation, and if you don't follow those rules, then they can put you in a jail. Yes. Okay, now we are in the MCA territory. Okay, we can put something like this and put it at the roadmap. We can put it here. As devices in the MCA. Stent аш пересал, бах.
Да, бірақ ана картриджі жоқ болмайтын болғандықтан тек корпус тағылар істеп жатырмыз.
Окей. Жаңағы нейрослайдер 21 болды ғой, да? Ашыңыз. Окей. Okay. Patient is pre-medicated with the ticagrelor, which is Brilinta, and we are short from cartridges for the very final. That's why we didn't test the patient with the Brilinta, because in our department the result of resistance with the ticagrelor is approximately 1%, and we have limited number of cartridges. That's why we kept them for the patients with the clopidogrel, because the resistance for clopidogrel is approximately 26% in our population. In the patients we checked in department, maybe in whole population it's quite differ, but in the department the rate of resistance 26%. Okay, now we can use 3D roadmap for the navigation. Okay, it was some tortuosity in proximal part. Doesn't want to go, huh? Okay. We have no headway, we have no rebar. That's why we should work with the device we have on the shelf. And this device doesn't want to work. We have support from the proximal part. Now doesn't want to go, huh? Okay. I don't know what's happening, but it doesn't want to go. It's not going, eh? Oh, shit. It's an air slider, huh? 21. I can damage my Vista. Okay. Outside. Okay. Doesn't want to go. What to do? Huh? Just a second. Let's check.
Ай-яй-яй.
Y connector өзгерте салсаңшы. Yeah, басқасын бере салсаңшы. I think this Y connector is not working. Yes, it's a standard catheter 21, and now we couldn't push the Stent inside. Okay, now it's coming. Okay. Okay. Let's take distal access catheter. Just a second. Just a second. Wacht. Okay, we'll have ace op 6. Okay. The stent could push through the catheter, but I have no idea what was the cause of non-possibility of pushing through the. Okay, let's take a distal access catheter, which is A68. Так, носа. Казвам на ново. Сега ние сме на остро жирство. Остро. You can draw this one. Все, желаешь. Желаешь. Клапай. Okay. I will send it directly inside the 8 French guiding. Usually it's not a problem. Okay, let's take this one. And then the microcatheter with the stent inside, we will place through the ace. Okay? Okay. Stop. Spot mask. Okay. There is a spasm. It's not a problem. After placing the distal access catheter, I will take the guiding liquid back. Okay. Now we are in the territory. So I think it's enough. Okay, now we can push it directly. Okay, I hope we can place it. Капельница с нашего весу. try to push it here. Let's try to push it here. Interesting. Yes, I have no idea why why it's like this. Because outside it was working. Okay. Just a second. This is a catheter and this is a stent. Now it's coming. Yes. Okay, let's try again. Okay, let's try one more time. Yes, we are in a very limited condition, that's why I couldn't throw the stent. Okay, now it's going, yeah? Getir. Sninktur geçir. I think from this point it's okay. Aye. Okay, now can I rotate it? Let's place it again. Now I couldn't place it, eh? Okay. Just a second. It's a typical 21 microcatheter. Now it's not possible to push. Outside is working, inside is not working. It's a question of just $10,000, huh?
Давление.
No, it's opening quite easy. Yeah. Okay, let's try to push it like this. Almost. Okay, this is a point of possible return, and now we'll push it. Okay, this is for the scientific books, huh? Now stand is in place, it's partially opened. Okay, let's try to open it. Yeah, the distal part is opened. Okay. Tartıymış ama. Şunu tartayım dedim. Now we're opening. It's okay. Okay. Now stent is delivered. Huh? Okay. This looks okay. Stent is opened nicely. Now the question is the proximal part. It looks like there is no deformation. goes around the stent. Huh? Okay, let's take balloon. Бақ, мына жерде көрсетіп жіберсеңші, мына жерде. Екі нож. Okay, let's take eclipse balloon. И маған трехходовой краник керек. Керек жоқ. В принципе, керек жоқ. Yes, let's take eclipse. The stent is well wall opposed, but the proximal part is not enlarged. That's why there is a question: should we do anything else, or just we need to push the stent with the inflated balloon? Let's see. This is for hybrid. Yes, it was a little bit stenosis before the aneurysmal segment. That's why stent is well opposed, but there is a difference between paraclinoid segment diameter and the cavernous segment diameter. It's approximately 1 millimeter difference. Let's see what we can do. Maybe we will maximum push the stent as much as possible. Let's see. Yes, and in the evening I have a flight. That's why. We have another two cases. One is vertebral orifice. Позвоночный шахреверс. And then the other patient will come with the aneurysm. Okay, I make a J curve. Okay, let's see. And I still have no explanation why the neuroslider was not working from the beginning. And we should open the stent as much as possible inside the guiding catheter. It's quite surprising, eh? Because the device should work, but it was not working. Okay, let's go. Now we are inside the stent. Okay. And I will inflate the balloon. Okay, now we inflate it as much as possible. The stent is opened. There is no doubt about the opening of the stent. That's why we can push a little bit. Okay. Okay, let's check. I think there is no problem. Nice stagnation. Stent is opened very well. Now we can finish. Okay, let's do it maximum and zoom. out the bedding, and there's distal axis. It's a little bit back. Now we can do the angiography. Now we're working more than 7 minutes. And everything looks okay. There is no problem in distal territory. All veins are in place. Okay, let's check the anatomy. Just a second. Now we can exit with histogram, and now I will take the review. Okay. Yes, this part will be okay, no problem. This part will be okay. Stent is fully opened. Nice. Little bit step. It's Istanbulay, Naji and Saru Çekirge is saying this is Istanbulay. And the aneurysm starts somewhere here. This segment is fully opposed. This segment is also fully opposed. No problem. Yes, okay. Now we need to do angiography of the aorta, abdominal aorta, to exclude the renal stenosis. Because the ultrasound was showing some renal stenosis. Okay. Okay, this is L5, L4, 3, 2, 1. My guiding ace is at the level of L1. Okay, let's take 20 cc. Abdominal aortography. No stenosis. Okay. Now I will ask Rowan to do CT. Okay. Okay. Қалайсыз? Жақсы. Бітірейін деп жатырмыз. Қазір томография өтеді, мынамен.
Қолыңызды бере әкеліңіз.
Все, жақсы. Ем болсын. Жақсы. Ойдағыдай бәрі.
Қолыңызды сызып.
Қолымды ма? Ұстай қойыңыз. Жақсы. Жоқ. Ем болсын. Все, жақсы. Рахмет. Қоя салыңыз қолыңызды. Қазір катет түсіреміз. 1 секунд тұра алмадыңызшы. Все, түсіре бер. Okay, dear colleagues, the CT is ready. CT, computer tomography. This is a stent, distal part. There are meningioma, no? Okay. The brain is clear, the stent is clear. Okay, let's see in sagittal. This is meningioma. And this is the stent. Stent is okay. Yes, stent is okay. Yes, stent is opened. Opened well. Let's check the meningioma. Можно будет общий вид дать. Yes, it was something from the right side. I'm not sure. Not so significant, that's why. Okay, let's check again the CT, coronal view. This is right side, and the meningioma is also on the right side. Okay, let's follow the meningioma. It's not so big. Let's check again the circulation. Yes, the meningeal may be going, but okay, let's follow the meningioma. Thank you for watching. In next 20 to 30 minutes we will start the case number 3, which is vertebral artery stenosis. Thank you for watching. Thank you. See you.